in the studio. Welcome. Hello,
1,000
Stephanie.
1,000 episodes.
1,000 episodes. We are here to talk about 1,000 episodes. So we are in the studio. We've invited our listeners, all of you, to send in some questions for us to answer. We've got some voice memos. We've got some emails. And then I've also been compiling questions that we've received throughout the year that I'm just going to call listener questions. To start off, I do want to remind everybody of our origin story. So we launched on March 3rd, 2020, in the very early days of the COVID-19 pandemic. And then as time went on, we branched out to cover tons of different public health topics like aging, mental health, environmental issues, nutrition, and humanitarian health. We were a daily podcast for a while. I don't know if you all remember that. I do.
I think we were twice a day.
Right, for a
little
while.
bit.
A few times we were twice a day, yes. And actually, it is a bit of a misnomer that this is our 1,000th episode because, Josh, do you want to explain why?
Because we had bonus episodes.
We did. We have an uncounted number of bonus episodes. So we probably hit 1,000 episodes a long time ago. But this is, for all intents and purposes, our 1,000th episode. We slowly started to branch out after that daily podcast into other topics. And thinking about the last 1,000 episodes of the show, I want to go back to one of our first listener questions that we received this year. If we could go back to that very first episode, what advice would you give yourself or to the team?
Could I go back to right when we got started?
Okay.
Why we got started. The pandemic was happening and everybody had questions. Like you couldn't go anywhere without running into questions.
Mm-hmm.
You read the newspaper, you watched TV, people were asking what was going to happen, how serious was it? And there were so many people here at the Johns Hopkins School of Public Health who were working on the pandemic, who knew a lot about infectious disease transmission or hospital epidemiology or virology. And so it really began as, well, let's just ask questions to people and see what they say. And we had a whole episode devoted to listener questions like every Friday for a while. Mm-hmm. And that kind of carried it forward, that like you were just trying to answer questions that people had. It felt like even though we were doing 1 or 2 episodes a day, we could do more. There were still more questions. There was so much to do. I think at the beginning, it wasn't really clear how valuable it would be, And I think that we learned that over the course of the year. We really gained an audience. We had thousands and thousands of people listening. We had so many questions coming in. And eventually we had the opportunity to think about topics that we thought would be interesting to our audience as opposed to just ones that they were just throwing at us. And, that evolution happened. And I think gradually we've gained confidence because really, truly, we had no idea what we were doing at the beginning other than just trying to get some basic questions answered.
Yeah. Yeah. Stephanie?
I think that it's been very interesting to watch it, as you say, evolve because, I don't know, I had never done any sort of podcasting before. My background was in print journalism, so I knew how to ask the questions, but I was very uncomfortable. Like people were going to listen to my voice, and I was going to have to make them want to listen to my voice. But I think the most important thing has always been that we choose the right experts to talk to. I've always been a big believer in just figuring out who the right person is to ask and then just ask away. And so I think that's something that has always sort of guided me from topic to topic.
Well, I remember right at the beginning calling you up and saying, Stephanie, we're thinking about doing a podcast. Would you be willing to be an interviewer on the podcast? And I'm pretty sure you said, I don't know, maybe for a couple episodes.
I just didn't think we'd have enough to talk about.
Thousands of episodes later. Yeah. And I think for me, and I starting out as the producer of this project, I didn't have any experience producing a podcast. And I think that the advice I would have given myself then is to come into this project like you would any other project. Learn as much as you can. I had no idea the size of the team that it would take to sustain a project like this. When you talk about all of those questions that we needed to answer, and when you talk about finding the experts and vetting the topics and figuring out between the three of us and the team, what are we going to cover? What's important? That I just had no idea how much work was involved. I think I'd always just assumed a podcast was like, you get a mic, call someone up that knows something, have a little conversation, and put it out on the internet, But we have a staff of, like 15 some odd people, all of whom, this is in addition to their full-time jobs, help us out on this podcast.
It is a labor of love. And during our staff meetings, everybody's got ideas for different episodes. And we're kind of talking about what can work and what not can work. And having that team is incredibly important. And your role, Lindsay, has been incredibly important too. People ask about what it's like to start a podcast, and it's really, really helpful to have someone whose job it is to think about whether the podcast is working, what's better, what's worse, what needs to be changed. And you played that role well before you became a host.
People ask me questions about the podcast and how it works and logistics, and I say, "Oh, you'd have to talk to Lindsay."
the background of it, yeah, how the sausage gets made. So I want to move on to another listener question, because over time, as we've been doing this podcast, our approach has changed a little bit. Yes, we started off by answering questions that people have and questions that we had. I think that's one of the value that we brought to this podcast is we're also people that wanted to know things about COVID and about things about public health. But really in the past year, we've shifted a little bit and we've been covering a lot of news and headlines. And in thinking about that change, one of the questions that we've gotten is how has your own personal thinking changed because of a particular guest or topic? And I'm thinking especially in the last year. So I know we need some time to absorb that question, but
I would say I learned something from every podcast.
Right.
I mean,
Yeah.
they're really that's really my goal in asking questions is to try to understand a little bit better. Trying to think of a recent podcast. We did the podcast about acetaminophen and whether it's safe to take during pregnancy, whether there's a risk of autism. That was a really interesting interview with Dr. Brian Lee, and he explained how to think about different types of studies and what their relative strengths and weaknesses are. And then we followed up with Dr. Stewart, kind of with the big picture of how she thinks about whether one thing causes another or whether it just appears to cause, a consequence. That's really interesting. So, I think that's really my goal. If I finish a podcast and think like, well, I already knew all that, then I kind of think that's probably not that helpful for listeners either.
Yeah.
It's funny because oftentimes when I set out to interview a guest, I give them the topic and then they say, well, what questions are you going to ask? And I don't really know until I sort of start having the conversation. I said, well, generally I'm going to ask you about topic A, but that person will direct the conversation as much as I will. Like they'll tell me something that's so interesting and I'll have to, I will very quickly come up with something else I need to ask and ask all around to learn. I learn all kinds of crazy things on this podcast.
One of the things that I appreciate, and I've learned this from Stephanie, is the value not of a question but of a statement.
Oh, yeah.
That then triggers the other person to sometimes go in a completely different direction. Like, that's got to be the most frustrating thing in the world. And they go, you don't know the half of it, and then, or whatever it is. But all those things are really interesting. This is not like scripted. It's not like we know what's going to happen when we go into an interview, and our goal is to get information that's new and useful and does change our own perspective.
Yeah, I mean, my friends and family will know that one of the things I say probably most often is, oh, we just did a podcast on that. So I think for me, I feel like the process of producing this project, I feel like I should have gotten an MPH in the process because I've just learned so much about public health. I feel like it's made me a more analytical listener. It's also made, me ask better questions. Like listening to your interview styles has helped me hone my own. And also I think that there's something to be said for the volume. We're here talking about our 1,000th episode. Like we are still learning and refining and doing things differently with every guest, with every episode. And I think that this is a question that you could ask us again and again, and it will just keep changing. the answer.
So question for you, Lindsay. You mentioned your family.
Yes.
How many are loyal listeners of Public Health on Call?
My family is more of they get the personally curated version where I'm like, you might be interested in this episode, but I have friends that are extremely loyal listeners and big fans of the show. So I'll throw that question back at you.
Well, very loyal listeners have met my mom on the podcast. So I get feedback / criticism for pretty much every episode of Public Health on Call. She's a huge fan of both of you two, I should add.
Oh, good. So we're perfect.
Yeah. But I don't think my children between them have listened to one episode, but that's probably what I would expect. And my wife has been on the podcast very early on talking about COVID and addiction treatment. And occasionally we'll listen or say, she's more likely to say, I heard someone talking about the podcast. And so then her ears perk up and she lets me know.
Yeah. What about you, Stephanie?
Oh, well, they will listen to the ones that I instruct them to and ask to. But for the most part, my husband will listen, which I think is very sweet of him. But my daughter listened to one 2 weeks ago and gave me a whole analysis of it. And, well, this is interesting because of this and this
Unprompted?
and this. Totally unprompted.
Oh.
She saw that I had posted it on LinkedIn and she decided to listen.
Oh, she follows you on LinkedIn.
Yeah.
That's sweet.
She's 18.
Yeah. Okay, so we're actually going to go to our first listener voice memo. So we had listeners send in some voice memos. I'm going to play the first one. There's actually 2 questions in here, but we'll just play it and then we'll see how it goes.
Hi, this is Jane, and this is my question. Public health deals with risk at the population level, while a lot of today's health culture emphasizes wellness on a personal or anecdotal scale. As public health podcasters, how do you balance communicating evidence-based population-level science with listeners' individual experiences or preferences? Also, how do you keep your content engaging when competing with wellness podcasts that often prioritize sensationalism over science? Thank you.
Well, first of all, thank you, Jane, for sending that in. That's a great question.
That is a great question. And, the truth is we have a large listenership for our type of podcast, but we do not compete with, the podcasts that are very, very influencer focused and quite sensational in their topics. And because we're not that kind of podcast, and we kind of have to decide that we're not going to be talking about, the brand diet that could change your life or whatever else the topic at the moment is. But even within what we cover, there are things that matter for individuals and the decisions that we make, and that is part of public health, as well as the broader population-based policies that can have a huge impact. And I think some of the best episodes can tie those two together. But sometimes we'll do one, sometimes we'll do the other. That's the beauty of 1,000 episodes. Some of our podcasts are a little bit more individual focused. But I think if we do too many of those, we're losing the opportunity because the public health topics that we're covering are incredibly impactful. And I don't think they're well covered in the other media.
Mm-hmm. And I think that focusing basically on what the evidence says, what the experts say, asking the correct experts to give us information and answers. I think that that's sort of the special sauce here. That's how we maintain the trust of the listeners, and we maintain that we are, giving people the most accurate, up-to-date information that there is. And so sometimes we'll do an episode where, for example, I did one on seed oils, right? And how dangerous are seed oils, because if you go onto TikTok, everyone's talking about how dangerous they are. And I sat down with an expert from Stanford who said, well, maybe. It depends on how you're using them. And it depends on the evidence says this and the evidence says why. And so to me, it offered a really good counterpoint to the kind of sensational stuff you may find elsewhere.
I've also found in almost even the broader public health topics that we cover, a lot of the times the experts will have a personal story of how they got involved in something. And so to say, just because we're not maybe the podcast that is giving out self-help tips or, personalized medicine, these stories are very personal. If you talk to most, a lot of people who work in things like harm reduction, it's because they had a sibling or a parent or a partner who was dealing with that kind of thing, So I think the personal really is public health in a lot of ways, and it drives a lot of people to this work.
I think it's worth just pausing for a second on this concept of an expert who we might interview. First of all, sometimes we interview people who are affected by problems and not people who just study problems, and they're experts in a different sense. But when we're trying to find good people to interview because they study problems, we're looking for people with open minds who can talk about different dimensions of the issue. It's not necessarily someone who is fixated on why they're right and why everyone else in the world is wrong. And I think sometimes other podcasts, will feature somebody with a very, very, very strong point of view. And we've tried to be a little bit more nuanced in that, where we bring people in, we might ask them, well, what do you think about this other idea? And they'll say, well, I understand where that's coming from, but here's why I disagree, or here's something true about it, but something that still is unproven. And really try to get to that level of nuance that can be missing sometimes from the information environment that we're in.
Okay. This question comes to us from Estelle.
Hi, Dr. Sharfstein, Stephanie, and Lindsay. Congratulations on 1,000 episodes. I'm a big fan of the podcast. My question is, which episode was the most fun for you to make?
First of all, could I just say, it was a great question, but I wish she had said Josh. Stephanie.
Dr. Sharfstein.
I mean, almost everyone calls me Josh on the podcast.
That's true.
By design.
That's
true. I
true.
try not to be Dr. Sharfstein on the podcast.
Right. Okay, Josh.
Dr. Sharfstein is my mother.
Oh, well done.
Yeah. So I think there are a lot of fun podcasts. I'm thinking one of my favorite ones was interviewing a professor of Scandinavian literature about Enemy of the People. That was just so interesting. A play by Ibsen about a public health official who gets run out of town, and exploring the connections between 19th century Norway and, the pandemic era United States was really interesting. And because it was in the realm of literature, more fun than a different kind of discussion about the pandemic and the situation. But I don't know. I think I could think of a lot of interesting ones. I think I interviewed Marin Alsop at one point.
Yes.
An
the
amazing
conductor for the Baltimore Symphony Orchestra.
conductor. That was really fun. But I should say, and the podcast we do about books, people explaining what they have in mind.
And you read all the books.
I do.
We all do.
I do read all the books, yeah. And so I think that's really fun. It gives people a chance. I can say, as having written a book, when somebody asks you about a book, it's really fun. So it's fun to ask about a book. It's fun to be asked about a book.
Yeah.
So maybe someday I'll do a podcast with myself and get both ends of that.
Just Josh talking to Josh.
Yeah, I don't think
about
I would listen to
books
that
you've
one,
written.
but I'm just
Your mom would listen.
I'm
to
just
it.
thinking my mom would listen to it and heavily criticize it.
Stephanie, what's been the most fun for you?
I just love the opportunity to ask a lot of questions. I mean, I'm a really curious person. I always have been. And this podcast gives me license to kind of ask whatever questions I feel like asking at the moment, like whatever comes to mind. And they're very much, as I said, it's very much a conversation. I don't know what I'm expecting to get out of somebody. And I love when I meet a new friend this way, or I find somebody whose work is so fascinating. I'm like, oh, we're going to have you back again because we need to talk about this and this and this. And so the interaction that I have with the guests, it's really very valuable to me.
I appreciated the podcast you recently did that we posted on pet owners and vaccines and pet vaccine hesitancy. And I think you said something like, I think we're talking about the hesitancy of the owners, not necessarily the pets. Yeah. So you got the sense that you could.
Yeah. There's a lot of banter, especially it depends on the personality of who you're interviewing, but there's a lot of stuff that doesn't make it into the podcast that for those of us that are on the editing side of things, I get to listen to some of the fun things that happen, but before and after the mics are turned on. I think for me though, what's been the most fun, honestly, I love being in person. A lot of times we're recording these over Riverside. We used to use Zoom, and so we're virtual. We're in our offices wherever. But we've had more and more opportunity recently to come and be in person in the studio. And I love these conversations. I think they have a different vibe. Maybe that comes across in the audio as well. So I think they're a lot of fun. But I want to go to Estelle's second part of her question.
And I was also wondering, since I'm really interested in Baltimore-related public health issues, having lived here for the past few years, if there are any Baltimore-specific public health issues that you're interested in diving deeper into in the future. Thank you.
So I want to start by answering this one because I am obsessed with the Baltimore Harbor.
I know.
This story is fantastic. We did the Swimmable Harbor podcast. I just got to do a follow-up with Adam over at the Banner, and he's just as obsessed with this topic as I am. And when we sat down to record the podcast, I was like, oh my gosh, finally someone else that wants to hear all about everything. I'll go on walks with friends or with my husband around the harbor, and I'll be like, the water wheel is positioned there because the Jones Falls comes down into the. So anyway, that is my personal obsession with the Baltimore public health story, but I know both of you have other things to talk about as well.
I think you should do one of those from the harbor.
I really want to. Actually, we've done some like video, but we should actually like record live like down.
Yeah.
I wanted to do the harbor splash. I would swim in the harbor for this podcast.
Yes, but you should be recording.
I'll do it. We'll figure out like
while you're doing it. I mean,
recorder.
when I recorded a number with Principal Matt Hornbeck from Hampstead Hill
yes.
Academy, those were super fun.
Yeah.
Going into the school, watching the effects of the pandemic kind of wash away a little bit, and kids go back to school was really great. So getting out a little bit more. I do think there are a lot of great public health stories in Baltimore. Baltimore is an incredible public health story as a city right now because the homicide rate is at historic lows. The overdose rate is dropping. We have right now the city's infant mortality program is a national model, and other cities are learning from it in a big national collaborative. I was the public health commissioner of the city. I could only dream of a day when we had this kind of progress in public health. So I think that there's so many different dimensions to how and why the city is making this progress. And I loved the podcast that I got to do with Mayor Brandon Scott, where he got to talk about his approach to violence reduction and how he stuck with it even in difficult times. And I think Baltimore is a national story, not just a Baltimore story.
And I love hearing Josh's perspective on Baltimore because I know that he used to run the city health department. And so, in fact, we met when I was covering the city health department for the Baltimore Sun, and he was the city health commissioner. And so I love to hear sort of what Josh's perspective is, the history of a story told through Josh. And of course, he's equipped with so many ideas for solutions that, I always want to hear what Dr. Sharfstein has to say.
Well, I can say that Baltimore is a story to pay attention to.
Yeah, for sure. Next question. What's been a particular, and this is a listener question, what's been a particularly challenging topic to cover?
I'll jump in and say, I think some of the disputes over pandemic policy have been difficult to cover. And we have covered them in different ways. We covered them even at the time in different ways. We haven't necessarily gone with the approach of taking people with very strong views on different sides. We've generally tried to find someone who can talk about those views and give a perspective on them. Like I was saying earlier, an expert who can bring some nuance to the story. But that's left us vulnerable on different sides for people saying, well, why didn't you have somebody who really strongly believes this or that? And, I think it's something we're evaluating. We have had people with very strong views. We've had now some really intense discussions about pandemic policy. But I think it's hard, in part because the topic is so hard. People have very strong views. And many people are wanting to hear what they already think, perhaps. But we should be trying to illuminate as much as we are trying to add heat.
Yeah.
I think that something that I cover a lot that I feel is not an easy topic is vaccination, which you'd think it would be. I always thought it was a no-brainer. Everybody needs to get vaccinated, and we've seen public opinion all over the place. We've seen misinformation from the government. We've seen a lot we've seen a lot that we have to really think about and convince people to do things that I thought were just something that everybody did, right? I mean, yesterday I was in a shop and I was talking to the woman working there, and she was saying how she wasn't really sure if she should really get the flu vaccine and the COVID vaccine, and I could tell that she was interested because I said I'd worked in public health, and I explained to her I was trying to find the most politically correct way to say it, but I did encourage her to get her vaccines, and I said I promise you that there's no harm from getting them, and they can only help.
Were you wearing your public health on call hat? Was that why she asked you those questions? Yeah. Well, I mean, look, it's complicated. Vaccines have side effects. Every medication has side effects. In general, when vaccines are recommended, it's because the benefits far outweigh the risks to people, and it's important to be upfront about both of those. Unfortunately, we're in an environment where there's so many falsehoods spreading about vaccines that a lot of people are confused. And I think it is important for those podcasts that reach millions of people to be providing good information to them, and for all the influencers out there to be paying attention, because there's an awful lot at stake. The United States is about to lose a distinction of being measles-free, and that is not good. And so I really hope that we can have those more clear, science-based but nuanced conversations about vaccines that help people make good decisions for themselves.
Yeah, and I'll just add that this year has been particularly challenging because we've essentially been operating as a newsroom, and we are not a newsroom. The team has really risen to the challenge. We, at one point earlier in the year, we're back to almost 5 episodes, so daily, just trying to keep track of all of the changes that were happening, and also trying to lay the baseline for some of these systems that are being dismantled. And you sort of have to work with a newsroom perspective of trying to churn out and respond to the headlines, while at the same time being mindful of the shelf life of things and how fast you can get something out, and then knowing that that's part of your permanent repertoire. Like, we're at 1,000 episodes, but I see episodes from 3 or 4 years ago sometimes get resurfaced in the news or quoted by a reporter. And so it's like you want to do your due diligence so that you're being responsive to what's happening in the moment, but it's also something that is going to stand the test of time, and that we're on the right side of history with it. So, and that can be really hard, and that's, I think, where nuance comes in. Did you want to add on to that?
No, and look, as evidence changes, we changed the topics that we covered. We brought other perspectives to the fore. We'll continue to do that. But I think you're right that we have to respond to what's on people's minds, but hopefully in a way that's thoughtful and will stand the test of time. I actually bumped into a faculty member at another school, public health, who said that she assigns 6 episodes, that her students can pick 6 episodes of Public Health on Call to listen to and write a reflection about as part of getting to know public health.
They're probably all Stephanie's episodes.
Yeah. That's what people will choose.
Right,
so,
right.
Yeah.
Okay, last question, and then we will bring our 1,000th episode to a close. What do you want to cover? What do you want to talk about? Like, what's the next big story? What do you hope to see?
I'd like some good news. I really do feel that there's been a lot of difficult topics. It's been a really rough year. I would like to, I do these interviews, and I'm looking for some kernel of hope when it feels as though we're just talking about all the things that are going wrong. And so I personally am looking for that kernel of hope. I worry about the future of public health. I worry about the future of democracy. I worry about a lot of things going on in the future, but I'd like to see something positive. Maybe 2026 will be a better year.
You did just do the peanut allergy episode.
I did just do
very
that. Was very
optimistic.
optimistic.
That was very heartening. Josh?
I would say it would be great to explore areas of common ground on the podcast. Our society is very divided. Yeah. It is definitely in my mind that the idea that we should be healthier, that more kids should, do better in school because they're less sick, that people can continue to enjoy the activities that they love for longer periods, that these are things that shouldn't be political at all. And that in pursuing better health for ourselves and our neighbors, we can find a lot to agree on. So it would be good to find areas where people are coming together around health rather than health topics that are dividing people.
Yeah. And showing, I think for me, showing where public health is working and where it's doing a really good job and where it is making those differences and lifting up those examples. We got to kind of help public health's brand a little bit, you know. Well, Stephanie and Josh, thank you so much. It's been lovely. 1,000 episodes, maybe 1,000 more to
I
go.
thought you were going to say we'll see you at 10,000.
Yeah, we'll be back in the studio for our 10,000th episode, which at the rate we're going is going to be a lot sooner than we thought it was going to be. But thank you both so much. It's good to see you.
Good to see you. Thank you.
Sure.
Thank you both.